Good morning.
Morning.
Glad to see you all got out of bed to get your day started, and hopefully this will be a worthwhile hour. First, I want to thank Lou for inviting me to come. This is the first time that I can remember being in Canada, so kind of a new experience. I was working on my Canadian accents and words, but I'm not going to insult anybody, so I won't use those. But it's a nice little twist on the American language that I listen to. I'm really excited to be here today. I came in yesterday and I attended most of the sessions. I took notes. I thought there was a lot of good information. I am really regretting that I can't stay for the rest of the day because I think you have some great speakers lined up. I met Wade last night, talked to him. I feel like we're kindred spirits. We have a lot of the same ideas on health and wellness and exercise, and there he is. So I'm glad he's here. I think what I need to do first is give you my background, and because it's kind of interesting how we end up in this business, and I think it'll help you understand where I come from and why I have some of the belief systems that I do. I always wanted to be a doctor. When I was a kid, I wanted to be a plastic surgeon. I like art, I like to draw, I like to do sculpturing, and I wanted to be a plastic surgeon. So I went to Brigham Young University for my undergraduate studies in Utah. It's a beautiful setting, beautiful campus. My first semester in college, I got mono about a month into it, and I just could not get out of bed. I couldn't get to class for about a month. And as a result of that, my grades suffered, not terribly, but I got mostly C's. The next semester, I went to the pre-med advisor and said, am I still on track to go to medical school? He said, mathematically, you're out. I said, what do you mean? He said, well, if you get straight A's from here on out, your GPA will be about a 3.7. That's not going to be competitive enough to get into medical school. So I was pretty discouraged and decided if I wasn't going to go to medical school, I wanted to study nutrition because my mother had a diet center franchise. She worked with weight loss. My father was a coach. He's coached at the high school, college, and Olympic level. So dinner discussions were centered around exercise, training, nutrition, and just health and wellness. My dad also taught biology and was an elite athlete himself. So nutrition was a natural transition. So after I finished my bachelor's degree in nutrition at BYU, I came back home to Columbus and I went to Ohio State. My goal there was to get a PhD in nutrition. I found nutritional biochemistry fascinating. And so this is the building I lived in for 8 years. And for 8 years, I was studying to be a nutrition scientist. And about 2 or 3 years into this, I decided that I wanted to be a physician. Now, what I said at the very beginning was really important, and I need to emphasize that. The mistake that I made as a freshman in college is that I believed somebody else. I didn't believe in myself. So I'm going to start with that point, and I'm going to end with that point. So as I went through my graduate studies, I loved nutritional biochemistry. It made sense. Everything sort of fit together with food. We literally are what we eat. We're nothing less than what we put in our mouths. And so 2 or 3 years into this, I decided I really wanted to be a physician. I didn't believe that pre-med advisor anymore. It was quite a struggle to convince my wife, who was 7 months pregnant with a second child, that after I finished my 5 years of graduate school, I was going to go to 4 more years of medical school and then a residency. So she cried for 2 weeks every time she looked at me. And so anyhow, I was accepted to medical school, completed all the PhD coursework, and as I was finishing the research, I had been accepted. And I told the College of Medicine that if you just give me 1 more year, delay my entry for a year, I'll finish my PhD research, and I'll have a PhD in the School of Medicine. So they said, fine, we'll hold your spot for a year. Well, a year came and went. The research was not working. I had to switch projects. Another project, that didn't work. I switched again, and I asked them, can you hold my spot for another year? They said, sure. So this is 2 years now I've delayed my entry to medical school. And I finally was in a project that was working, but I was working with an advisor who, within 2 years' time, the 10 people that worked in the lab with her had either been fired or quit because she was just abusive. And she literally wouldn't talk to me for 6 months. And this was not the type of setting that I was going to finish my research in. So I asked the medical college, I said, can you defer my entry 1 more year? I said, nope, this is it. You either come now or we're going to give your spot to somebody else, and there's no guarantee we're going to let you in medical school here in the future. So I had a decision to make. It was 2 weeks before medical school. I was about 70% done with the research collection. I was all done with the coursework. And I decided to withdraw my application to medical school, that I couldn't come 8 years in nutrition, 8 years on something that I worked at, and walk away with it with nothing. So I handed my letter of resignation to the Dean of Admissions on a Friday afternoon at 5 till 5. And he said, I'm not doing anything with this over the weekend. Why don't you hang on to this and make sure this is what you want to do? So over the weekend, I prayed about it, and the answer came. It really doesn't matter what I do with my life as far as my career, but what matters are the people in my life. So I decided that I would be happiest and that my family would not suffer if I went to medical school. So I changed my mind. So 2 weeks before medical school, I'm going to go to medical school, and somehow I'm going to try to finish this PhD research. It was close to being done. I was working part-time in the Department of Surgery. I was teaching a Bible study class for high school students at 6 o'clock in the morning on school days. I had 3 children. I was taking anatomy, and I was trying to finish the research. And about 6 weeks into that, I just burned out. And the only thing that I could give up was this PhD dream. And so I walked away. It was a huge relief, but it was a real tough time for me to walk away from 8 years of hard work. So then it was sort of, I guess I didn't show these slides here. I worked a lot with rats. It was really some interesting nutritional and exercise type of studies I was doing. What I learned from the research experience is that sometimes in research, it's like anything else. If you look for something, you think it's there, it's going to be there. And even the best efforts that we make to be unbiased in science, sometimes it's inevitable. It's still going to be biased. And I learned that there's a dark side to science as well. And what happened to me with this particular advisor was really driven by money. Another PhD student and I went to the department chairman after we had both withdrawn, and we told them what was going on. And they said, we can't do much because this is a professor who's bringing in $500,000 a year in NIH funding. Really sorry that this has happened, but you know, this is the real deal here. I mean, we're supporting research. So that was the dark side. On the other hand, my background in science tells me that I struggle with believing things unless there's some scientific documentation in it. So I look at it kind of both ways. So this was my experience in medical school. Ohio State was one of the best medical schools in the country for primary care. In medical school, it was allopathic. As we've heard, our job as physicians is to diagnose disease and then treat it with medications or surgery, and that's the allopathic model. So I sort of forgot about nutrition. Did a residency in family medicine at Grant Medical Center in Columbus. It was a great, great experience, but my nutritional training was not being used. Then I entered I was 40 years old when I had my first job out of residency. I had 5 kids now. And I was over $100,000 in debt. I had, and that was with government support. I got a scholarship through the National Health Service Court. Otherwise, it would have been over $200,000 in debt. So that's why I started. So I am employed by a small hospital in Northeast Ohio. About a year or 2 into my practice, I was getting really frustrated because I was seeing heart disease, diabetes, high blood pressure, high cholesterol. People suffer, and I'm writing prescriptions. At first, I thought it was neat. I had my pad that said doctor on it, and I could write prescriptions. And then I thought, this is really crazy, because they don't need this. They need to learn how to eat. They need to learn how to exercise. They need to learn how to manage stress. So I tried to explain that to them. And that got me nowhere, because as physicians, the way we survive is volume. The more patients you can see in a day, that's how you generate revenue. If you're a surgeon, you generate from procedures, but primary care, it's volume. That's why your office visits now are 7 minutes at times. And I was very frustrated with this. And my efforts to educate my patients was not working, because I was falling an hour to an hour and a half behind in the office. So I thought there was a better way, and I developed a wellness program in 2002 that allowed me to educate people somewhat formally, outside of office hours, over a 12-week period of time on nutrition, exercise, disease prevention. That program was really well received, but it was expensive to the community, because we were doing blood work and then monitoring their progress and giving them gym memberships. So it didn't work. It worked for about a year and a half. Fortunately, there was a grant writer at our hospital that wrote a grant application to Health and Human Services in Washington. And based on the previous wellness program I had, we were awarded that grant. It was a $365,000 grant for 3 years. We just completed those 3 years. Now we're into another grant, which is Worksite Wellness, where we go into the worksite and we educate employees on healthier lifestyles. We're in the second of 3 years in this grant, so it's another $365,000. We've had over 2,500 people go through the class, and in 12 weeks make phenomenal changes. Get off asthma medicine, improve their allergies, reduce blood pressure, reduce cholesterol levels, drop their weight, reverse acid reflux. So it's been really exciting and rewarding for me. In one of those wellness seminars that I was doing, there was a woman who was a healthy, very proactive person. She was a colon hydrotherapist. And she said, after hearing what you're talking about, you really need to hear about this Kangen water. And I thought she was a flake. I mean, water is water. But she was really nice. She was persistent, almost to the point of being annoying. But she wasn't quite annoying, and that's the key. So every week she said, you really ought to come. We're just going to have a demonstration at the local hotel, and I think you would really like this. Normally, I have a lot of people ask me, or bring these kind of things, ideas up to me, supplements and health-related type of issues. And I usually just don't have time. You just can't look into every product that somebody wants to promote. But for whatever reason, I thought, I'm going to see her for another 11 weeks. If I don't go to this, she's going to keep bugging me. So I went. And I thought it was interesting, but what impressed me was the demonstration that you've all seen. I think you saw that first thing yesterday. Because that was like being in a science lab. There was no magic, and it was very impressive. So that was my introduction. It was about 2.5 years ago. And I went home, I researched it on the internet, I looked at the competition, I got cold feet. She brought a machine, a Junior, installed it in our kitchen, let us use it, and that was a really smart thing for her to do. And we started drinking it, and my son's acne started to improve, his migraine headaches were gone. I started to have more energy. My daughter used it to detangle her hair. I mean, all kinds of things. And I thought, well, this is great. So we got involved. So 2.5 years later now, I'm a 6A. I've presented this talk to a group of physicians, and I've got physicians now who are starting to become interested and buy this unit. So that's sort of how I got here. So let's go on to the next slide. Leading causes of death. Do you know, now this is I think in the United States, but do you know what the leading cause of death is? Well, okay, now you got to think like a physician. You're thinking the right way to think like a physician. Heart disease, right? And then what would you say is number 2? Cancer. What would you say is number 3? Diabetes? Guess what's number 3 according to this study? Wow. We are a dangerous group of people. Okay, and now not every study will report it like this, but this study certainly did. Okay, so then let's look at these, and this shouldn't surprise you. Now, if you look at how we die from healthcare, now this is somewhat old. This is about 10 years old, most of these studies. I can tell you as a result of this, we've done a lot to try to correct these problems. We've done a lot in the hospital to reduce errors and mistakes. But the adverse drug effects is huge. I take care of inpatients, and frequently we have people from nursing homes admitted to the hospital. I can't believe how many medications they're put on, and I'm convinced they're medicated so that they're quiet in their room. They don't bother people, they don't wander. And these people, when they come to the hospital, I check their vitamin D level, I do all these nutritional studies, and I take them off medications. And I love taking people off medications. A couple days later, they wake up, they're interacting with their family, and they're feeling better. That is really fun. But there's a lot of adverse drug effects. This is kind of interesting. If you look at the prescription practices of physicians, we prescribe over 2 billion prescriptions a year. The average number of drugs ordered is 2.1. Every time you come in, the average person is going to get 2 prescriptions. Isn't that crazy? The percent of people who get a prescription is 71%. So 7 out of 10 people come to the office, get a prescription. That's what we do. That's what we're supposed to do. I love it. Well, I used to love it when somebody came in with high blood pressure. That was a catch-up visit. That's like, oh, you got high blood pressure? Here's your prescription. Come back in a month. Let's recheck it. Now I can catch up because that 15-minute slot only takes me 5 minutes. But that's the wrong approach. And the most frequently prescribed therapeutic class is antidepressants. This isn't true depression. This is anxiety. This is stress. This is over-medication. This is our lifestyle. And people need to be educated. And that's what I've learned teaching these 2,500 people in the community. They're dying, they're thirsting for information that they can follow to lead a healthier lifestyle, more proactive without the typical allopathic approach, which is surgery and medication. This is pretty staggering. This was several studies, and it shows that 91% of diabetics have a condition that is preventable. 82% of heart disease is preventable. 70% of strokes are preventable, and 71% of colon cancer is preventable with a healthy lifestyle, with the right foods, the right water, the right exercise, the right stress management. This is staggering. 6 out of 10 of us, maybe not this group, but the average group, 6 out of 10 people will die of either heart disease or cancer. 30% of you men will hear the word cancer in your lifetime, and 40% of you women are going to be told you have cancer in your lifetime. That is unacceptable. Now, we can do so much better. We're not going to live forever, but don't you want to live a long, productive life? You don't want to linger 15 years in a nursing home. I asked my daughter once, when was the last time you saw a squirrel or a rabbit in a nursing home? She's like, what are you talking about, Dad? I said, well, squirrels and rabbits don't go to nursing homes. They do what nature teaches them to do. They eat the food they're supposed to, they reproduce, they're active, they get sick and they die. They don't linger. You don't see squirrels and rabbits dragging around in the yard. They die quick. That's what we should do. We should live a full, healthy life, and when it's over, we die quickly. Now, sometimes in our quest for wellness, we fail to see that we are the solution. Now, this is where the technology always makes me nervous. Let's see if I can get this to work. Can you hear that?
Whoa, that's not good. Somebody will come. Anybody out there?
Do you have a phone?
Sorry. Somebody! There are 2 people stuck on an escalator and we need help. Now, would somebody please do something? I don't believe this. You gotta be kidding me. Well, not enough left to do.
Okay. I thought you'd like that. Let's see if I can- So this was the wellness program. Now, the point of that was, come on, people. That's how I feel like so many of my patients are. I've got high blood pressure. Would you give me some? I got back pain. I can't fix that. Give me a pill. Give me something just so I don't have to do anything. The solution is within us. And that's a belief system as much as it is a lifestyle. Okay, so as a result of that mindset, I created this wellness program, which has really become popular in the community. It takes a lot of my time. Now, there's one of the things that's really hard for people is all the information that's out there. A speaker yesterday said there is no truth. I'm gonna give you another perspective on that. I believe there is truth. I believe there's truth that's independent of our perspective, and we just have to understand those truths and comply with them. So as you look for sources of truth, who do you listen to? Who do you believe? And that's tough, because many of you don't believe your physicians anymore. And then there's all these other voices. Who do you believe? Because everybody wants to sell you, this next $1 trillion industry, the wellness revolution. Everybody wants to promote something, and what's good for you and what's not. You have to sort it out. Here are the 3 sources of truth that I've seen. First of all is science. That's my background. In science, we start with hypothesis, which is the expected outcome, and then we try to explain